Hello, it's Rafael Gutierrez, and today I'm going to finish the points of the head, which are actually with the Bubishi. Now, I've actually been using a couple different ones, so one of the things that happens is if you do study the Bubishi, you probably will see that usually it's 36 points, but what I've found is that some points are actually varied in other. So some points will say the eye, some points will say down here, some points will say the mastoid ear, and so you have some movement around of some of these points. What I hope I am showing is, yes, there are injuries that are capable of occurring when all these points are hidden. Like I said, today I'm going to finish off, so I'm going to talk about 3 different points in the head, and then I'm going to start moving on to the rest of the body. Big thing that uh, pretty much should be the take-home message is if you look at how many points in the Bubishi could potentially cause death or disabling injuries, what you can tell is that if someone gets hit in the head, they will probably hit some of these points just by accident sometimes. Now the thing is, some of them are actually based on angles, where if you hit the wrong way, you're going to cause more damage to yourself. But that's not saying that these points can't be hit on accident. It just means that yes, have to you also have to study how you're going to hit different things in self-defense scenarios. Always remember the way I actually think is most people who are training aren't really looking for, oh, this is how you kill or disable or maim someone. What you're looking at is what are points that I should be careful about when training. If someone gets hit a certain area, is it going to cause certain problems? And what you see is, yes, the reason that a lot of rules in tournaments have actually changed to don't hit the head, especially in full contact, is because of that. There's a lot of it. Now, before I go on, there is one book that I've been looking at a lot. I have owned it for a long time, and I really actually think it's probably one of the better ones on the Bubishi, and that's this one here, which is Patrick McCarthy's version of it. One of the reasons that I'm thinking that Patrick McCarthy's version is so important is it actually puts the Bubishi in a perspective. What I mean is, if you actually just look at the table of contents, it gives you the historic perspective of it. It gives you the articles of medicine and herbal pharmacology from China, and then it talks about the vital points. He does also mention certain things are legends, not necessarily the way they were. And one of the things that we have to remember with the Bubishi and a lot of other things is uh, just history. When the West actually came into China, they destroyed countless amounts of books, of written records, and we don't know exactly everything they know. What we do have is things that either survived or things that survived through oral tradition. And so sometimes they're not exactly perfect. Uh, and sometimes we do have more legends about it than reality. So today I'm going to talk about the last 3 points, and one of the points is down here. Now I've actually addressed this one before. Yes, if it's actually hit straight, can actually cause the person getting hit to accidentally bite the knuckle, causing something called fight bite, which is you can end up getting bacterial infection in the bone and losing your hand. Now, if you're actually going upward, like an uppercut here, it can whip the head back, cause whiplash. It can cause damage to the neck, and it can also cause a interesting rotation to the head. The other two are actually on the sides, one here, one here. And these, if they're hit, can cause the head to rotate. Now, the rotation of the head may actually start causing damage, but it also, as it starts, like I said, if your brain is actually floating inside a liquid, so the head starts rotating first, and then the brain moves. And so that can actually cause some damage. And when the head stops rotating here, the head stops rotating here, the brain can continue causing ruptures of blood vessels, which I've covered before. The other two on the back of the head, and I'm going to show you a skull for those because if you notice, even sports where you allow to hit the head, they have rules against hitting the back of the head. The reason is that can affect the brainstem, which is made up of the medulla oblongata, the pons, midbrain, and if you get damage there, you can end up damaging the respiratory centers, which technically means you stop breathing. You can also cause problems with the cardiovascular system. You can cause a lot of damage to specialized neural structures, which help you maintain life. And so that's one of the reasons why back of the head is always forbidden in a lot of full contact sports. Now, it's actually it's one of those things where it's like you don't want to hit someone in the back of the head for self-defense because of someone may be turning around. But if someone's rushing for your arms, you can drop and end up hitting the back, sometimes by accident. So it is one of the places that if you're a grappler, you may want, if you're teaching self-defense, you may want to let your students know that this is an area you want to make sure you protect, even if you're going into the legs. Now, one of the things I am going to also try to do from now on is I have a lot of books that I love. There's a lot of products that I love, and there's a lot of people who have actually told me about different things that they have, which they wouldn't mind if I mentioned a little of them. So I am going to start reviewing a couple products as I go along. Hope you enjoy those, and hope you find some of those interesting. The one thing I actually do also want to tell you about reviewing products is I'm actually looking at products that I actually use. So I use a lot of books. If you ever come to San Diego and you want to see what my library looks like, you'll pretty much sometimes, well, a lot of people have told me that they didn't even realize there were that many martial art books out there. I also study a lot of anatomy. It's my main area of concentration right now, but I'm actually going to be going into nutrition soon, so we'll see what happens. And the thing is, that I've noticed is when I review a product, a lot of times there are errors, which some errors are acceptable. For instance, if you're translating a date from the traditional Japanese calendar to the one we're using today, sometimes they'll be off by a year or two. Those, to me, those errors are okay. Grammatical errors, there is actually a book that I have which was written in Japanese, translated by someone who didn't speak English as their first language. And so there are a lot of grammatical errors, but you can still understand it. Those errors are actually a lot of times overlooked by people who really care about the subject, not about grammar. You have those people who just love grammar, and if you make a mistake on grammar, oh, you didn't do your due diligence. To me, it doesn't matter as much as are the facts the way they are. Even in my own book, I know that my first book, Serious and the Rarest Things, I've got a lot of great reviews by people, and it took me a while and I'm still going back and looking and finding little grammatical errors here and there, but a lot of people have actually looked the other way because of the story that I tell is one that they were looking for. The story I told in Serious and the Rarest Thing, for anyone who's interested, is just my stay in Okinawa, and I try to make it like a novel because what I found is most books on Okinawa, they're written almost like a journal, where it's like, today I trained in Yakuzuke. Yesterday I trained in this kata. I went to the castle and did this. And that's what I wanted to make something that people will actually experience Okinawa the way I did, even if it's just in literature, and maybe that actually helps people decide to go if they can. Right now, I've seen tickets to Okinawa from California can be relatively cheap. I've gotten tickets for as low as $500 round trip, but it's those actually took me 2 days to get there and a day to get back. So the thing is, it's like, yes, you can pay more to get there quicker, but if you're like me and you are trying to save money but still go, a lot of times we can actually do layovers, which is what I did in the book. I actually spent a day at China, actually 3 days in China, but that's not what I'm going to talk about. I am going to show you a video with the skull so you can see how and why these things work, and I'm going to start moving on. If you do enjoy these videos, please subscribe to the channel, and if there's anything you want me to cover, injuries you've had, injuries you've seen, things that you've been told, I will do that. And again, if you have any products that you think I should review, let me know, and I'll talk about them. If I don't have them, I'll see if I can get them. Thank you, and have a good day. Today I'm going to talk about a couple of the points that the Bubishi talks about. And what I will do is I'll use a skull so you can see a little better. One of the points is actually back here on the occipital protuberance. Now, a lot of people talk about how you're hitting the brainstem, and you may potentially do it, but not in the way that you would expect. Now, I have another model here where if we look here, it would be like hitting this area back here. Now, if you look, this area back here, you actually have the cerebellum, and behind it, right in front of it actually, you have the brainstem. the brainstem. If this does get hit, it can cause, well, one of the things I should mention is the brain is actually a little loose. It's floating in a cerebral spinal fluid. So severe trauma there can end up causing the area of the pons and the medulla oblongata to actually be damaged. Especially if you have enough of a whiplash, you can end up having it bounce against the front of the bones here. And if the problem with the brainstem, especially the medulla oblongata and the pons, is they are responsible for things like breathing and normal, pretty much normal vegetative functions. So with damage to that area, you can end up causing, could end up happening is death. Remember what I keep saying, brain trauma is not something you really want to play around with. And so that's one of the places that they talk about in the Bubishi. Like I said, I am going to talk about 3 different points because a lot of them I've actually talked about before. By the way, for those of you who, well, I put this together, for those of you who don't know, the problem with getting hit in the back of the head, as in the Bubishi it shows you, is that you can end up having, well, like I said, death. That is actually the reason why in boxing and a lot of martial arts they tell you not to hit there. Now the other points that I did want to talk about is one of them is right here. Now, a lot of people think you're going to punch straight here. The problem with punching straight here, I have a video on it. You actually can cause the skull to come in, which will end up causing what they call fight bite. And if you punch like it, doesn't matter how you punch. If the teeth go into your hands, you can end up losing the hand or needing a lot of surgery and removing the tissue. The nice thing about hitting here, if you are hitting here, you're better off going at an upward angle here. So almost like an uppercut, which would rotate the head and you can end up having brain damage there. The other 2 points that you tend to see are on the sides here. Now the advantage of hitting here, and like I said, I did a video on this earlier, is if you get hit here, it causes a rotation of the head, which can cause problems with the circulatory system. Now today I actually did just finish all the Bubishi points that I was able to find in the head. A lot of times people talk about the 36 points. As you notice that there are actually more than 36. I'm actually combining everything together so you get a lot of different points. Big thing you are noticing is this. Any head trauma can actually, pretty much, chances are if you hit the head, you're going to hit in some place where it can potentially do some damage to the brain. Any damage to the brain is going to end up leading to lifelong consequences. We see it even in people who wear boxing gloves and are boxing. You know, we see it. I mean, we see that they have an increased risk of Parkinson's, of a lot of brain disorders. In football, we've actually seen how the traumatic injury, even wearing a helmet, ends up causing changes in the brain. So one of the things is a lot of times people say, well, you know, this doesn't work. Well, if you look at the clinical anatomy, we do find it does have a lot of things. I hope you enjoyed this and have a good day. Next week, I am going to start going down the neck and finding the other points in the Bubishi and talking about if they work or not. Some of them may not be as practical as people would think they are. Others will be more practical than people think. I hope you enjoy this. Have a nice day.